Hey everyone, welcome back to the Npte podcast. This is Will Crane, your host. Thank you so much for joining me as we go through the content you need in order to dominate on test day. So today I've got a practice question for you. As you recall, as we go through this podcast, we're going through the FSBPT's published content outline describing the number of questions in each section. So today is no different. We'll be going through the genitourinary system. So the genitourinary system, you can expect somewhere between 2 and 5 questions on test day related to this. So clearly not a huge section on the exam. However, it is a critical one that you need to get those 2 to 5 questions right. Certainly a part of your active study plan to make sure that you go through each of these body systems. So the plan today is to go through a practice question. Be sure to check out all of the other episodes we've got here on the Npte podcast. Again, a totally free resource to help you prepare for the exam. One of the things that we've really worked on in the last, really since the start of 2024, is we made some pretty critical updates to our exam simulator. So if you want to take an exam in an exam simulator that mimics the FSBPT, or the Npte, I should say, be sure to look no further than PT Final Exam, our exam simulator. So not only do you get access to one exam, actually you get access to 6 practice exams as you purchase this our pretty awesome exam simulator. So in the exam simulator, just of note, you can create quizzes based on body systems. So much like what we're doing here, you can pull, select, and create quizzes based on whatever body system or content area you'd like to work on that day. So for instance, you could make a quiz of 10 questions related to the genitourinary system. You could make 25 questions related to just interventions across all of the systems. Whatever you want, you can build it. Now, this test bank is pretty cool. So you get access to it for 6 months. Once you make a purchase, you get 6 full practice exams. It really is an invaluable resource as you head through the summer onto your exam dates here in July or beyond. Plus, of note, the exam simulator is included free in our premium and VIP classes. So again, right now, we've got it at a screaming deal, so be sure to check it out over at ptfinalexam.com if you want to access our practice questions. All right, so speaking of practice questions, let's go ahead and dive into today's question. As per usual, I will read it to you, give you a moment to respond, and then we'll talk about it together. A patient with multiple sclerosis experiences bladder dyssynergia during micturition. Which of the following descriptions best matches this condition? So we've got a patient with multiple sclerosis experiences bladder dyssynergia during micturition. Which of the following descriptions best matches this condition? Number 1, strong detrusor contraction, involuntary urethral sphincter contraction. 2, strong detrusor contraction, involuntary urethral sphincter relaxation. 3, weak detrusor contraction, involuntary urethral sphincter contraction. And 4, weak detrusor contraction, involuntary urethral sphincter relaxation. So this is a mix and match question. You can see that we've got strong detrusor and I want to make sure it says right. Strong detrusor and involuntary urethral sphincter contraction. So strong detrusor, sphincter contraction, strong detrusor, sphincter relaxation, weak detrusor, sphincter contraction, and weak detrusor, sphincter relaxation. So again, the question is, a patient with MS experiences bladder dyssynergia during micturition. Which of the following descriptions best matches this condition? Well, when you consider dyssynergia just indicates that there is not good synergy or a dysfunctional synergy between the bladder and the pelvic floor or the urethral sphincter. And so what happens with dyssynergia is that you have a weakness of your detrusor contraction. So what does that do? So that weakness of detrusor contraction leads to a really poor emptying of the bladder. But additionally, this is the worst part, is that you don't get sphincter relaxation during micturition. Rather, you get sphincter contraction. So that's the real problem here. And so the correct answer is C, weak detrusor contraction with involuntary urethral sphincter contraction. So what's happened is that your detrusor is not working very well. As you try to evacuate the bladder, what happens is that your sphincter is not relaxing properly. And that's typically the synergy should look like this. You contract the bladder, the sphincter relaxes, and everything evacuates, no problem. However, in this case, you have a weakness of the detrusor contraction, so that's the MS kicking in, or basically you have poor tone Now, it's not that you don't have spasticity or hypertonia, but the trouble is you don't have very good contraction of the detrusor. Additionally, you're not getting relaxation of the sphincter, leading to this weak detrusor contraction with an involuntary sphincter contraction or closure. So therefore, the bladder cannot evacuate, meaning that you're not getting a good push and you're not opening the sphincter, leading to a retention of bladder or residual volume. Now, the trouble with that is it leads to what's called overflow incontinence. Now, think of it this way. Overflow incontinence simply means that the bladder cannot empty or is not emptying, so whether it be by obstruction or poor emptying, so poor mechanics of the muscles, regardless of what it is, the bladder fills and fills, it can't empty very well, and it creates an implicit or intrinsic pressure inside the bladder that finally starts to overflow, kind of like, think of like a reservoir. If you have a reservoir full of water, once it's full, any additional fluid coming in simply goes over the spillway, and that's what's happening with overflow incontinence. And so in this case, we're talking about someone with multiple sclerosis with bladder dyssynergia. They get weak detrusor contraction in combination with involuntary urethral sphincter closure or contraction, and that is the bladder dyssynergia. Excellent. So kind of an interesting question. And again, on test day, there's only a handful of questions related to the genitourinary system. But this question clearly talking about what is dyssynergia, and understanding that can help you work with your patients with MS, understanding that they typically have to fight this overflow incontinence. So how do you work with that? Well, you've got to work on sphincter relaxation as well as strengthening detrusor contraction. And a lot of that is done via medications or pharmacological interventions. So trying to reduce tone and spasticity, especially in the sphincter, is going to help with contraction, and so contraction of the detrusor and opening of the sphincter. So a lot of pharmacological interventions would be related specifically to bladder function. And then just, it's one of those things that folks with MS will have to fight pretty much the rest of their days, trying to fight this overflow incontinence that can occur. All right, so with that, we'll bring today to a conclusion. Be sure to check out ptfinalexam.com for all the other great products we have. We run courses constantly. So if you're looking for a way to study for the Npte that's in a effective and cost-effective way, look no further than ptfinalexam.com. Plus, if you haven't yet, it really only takes 1 second. Leave us a review over on whatever it is you're listening to this podcast on, whether it be Google Play, Apple iTunes, Spotify, wherever it is you're listening to this. It helps a ton as we're trying to get the word out. So do us a quick solid and leave us a review wherever it is you're listening to this podcast. All right, with that, we'll bring it to a conclusion. Hope you have a fabulous day. Keep a grin on your chin. Happy studying, and I'll catch you all in the next one. Thanks, everyone.